Yeah. So another question related to this sort of issue of timing and the protests, unpopular opinion, I think we are going to see a lot of illnesses acquired at these protests. And I have also noticed flying around on social media, the United States is seeing a little bit of a spike in cases right now. And I just want to talk a little bit about the timing of when we see when we might expect to see those infections emerge in the data, and why are we already seeing this spike? Alison, is that what you want to tackle?
Yeah, I mean, I think one of the things we all need to keep in mind is that these windows of, incubation period and infectiousness and time to symptoms, there are ranges on all of them. And when we see when community spread is driven initially by intra-household spread, we're also going to see a couple of cycles of incubation period before an event might lead to, to a community spike. And the third thing to keep in mind, and I think we're learning a lot fast and we don't necessarily know yet, is how important these sort of super spreader events and super spreader people are to creating hotspots or creating sort of new spikes. So if we just go by kind of our, the epi math and the infectious disease math that we know, we would say a big event, if there are going to be people there who are infected, other people are going to get infected, it's going to take, 1 week for one cycle and maybe 2 weeks for a second cycle. And so we should see the spike at 2 weeks. And when we don't, then we wonder, like, well, what happened? Was there no one there who was infected? Was there we just lucked out and there was no transmission? Was there something about that event that kept transmission in check? Or, there's just a lot of randomness in like what makes a super spreader event a super spreader event, besides being indoors, which is a really good way to make a super spreader event super spread. But I think as we look to the counties that have, or states that have opened up, and we look to these events like the mass protests or some of the stuff that was happening over Memorial Day weekend with some really crowded events, we may see some big spikes, or some of those events may not turn out to generate a lot of new cases. So there's just going to be a lot of heterogeneity in where and when we start to see some places tick up again.
A+, Alison, for nerdy girl word heterogeneity.
Heterogeneity, sorry, that's just like variation. A lot of differences across space.
Yeah.
Which I think is a great point, because it's going to make it hard to kind of assign, blame. Like everybody in the news for different reasons, wants to point to early lockdown endings or, protests and point to that if there is a spike later on. But it's going to be, because of all of this randomness, it's going to be very hard to just even look at data across local areas and attribute it to one specific event. So just keep that in mind if you do see that in the news, to have some healthy skepticism about any one policy change kind of leading to direct changes in the epidemic.
Yeah, I have seen claims flying around that the spike, it's not really a spike, but there's been a little rise in cases in the United States, and that's attributable to the protests. It is too early to make that attribution, but there have been a lot of other changes in the United States in the last couple of weeks here in terms of our shelter in place or our lockdown, our outbreak control strategies. So